Right. Well, Prof, let's turn our attention to a rather grim figure from last night when the Health Ministry reported that two youngest fatalities, they were 23 and 34 years old, and both had multiple underlying medical conditions. Well, as you know, most fatalities so far in Singapore were older people or unvaccinated people. But given these young deaths, should young people worry?
So maybe before I answer that, I would like to start off by expressing my condolences to the families of those who have passed on. And it's never easy losing someone in the family, especially uh, even harder when family has lost someone at a young age. Coming back to the question that you have asked about whether young people should worry, I think the focus by the public and also the media right now certainly is centering around the age of these individuals, that they are young and yet they died from COVID. But I think the real focus shouldn't be on the age, but should instead be on two issues. The first issue is that both of the young fatality, regrettably, both of them are not fully vaccinated. The second issue is that both of them actually had underlying medical conditions, and one of them had multiple conditions. That was what was reported. I believe that these are actually much more important to highlight and not the age. Because for a while now, MOH, the ministers, even Prime Minister himself have encouraged people to come forward to be vaccinated. And we have tried all manners of encouragement, including some F&B outlets even offering incentives for vaccinated people. And the reason for all these efforts, it's really because vaccination makes a difference between life and death, especially when one is infected with COVID. And vaccination is even more important if a person has an underlying medical condition. And I think this is independent of how young or how old a person is. So there are still people who think it's okay, I'm young, if I'm infected, I will be all right. And so some of these people chose not to be vaccinated. And for others who are not vaccinated, they may be worried because they have some health problems and they are worried that vaccination may not be good for them and that it will make them even more ill. Now, if you're someone like that, or if you know of someone like that, my advice is speak to your family doctor or the specialist that you're seeing for your conditions. Ask them directly, can I take the vaccination or not? Seek professional medical advice. Don't make the decision on your own. In general, people who are healthy and fully vaccinated, they don't need to fear COVID-19. If you have some medical conditions, it is even more important that you are fully vaccinated. And I think this advice holds true for people of all ages and not just the young people.